Good afternoon, and welcome everyone to today's seminar on the COVID-19 pandemic, presented by the Tuskegee University Integrative Biosciences PhD program. I'm Lauren Mayo, Integrative Biosciences PhD Fellow and Florida native. Thank you for joining in virtually and taking time to learn how to keep you and our community healthy and strong during this time. Currently, the world is facing a disease that is predicted to be worse than the 1918 influenza pandemic that killed as many as 50 million people. It's easy to get overwhelmed by these numbers and trying to decipher messages from the media and the government. Tuskegee University is a historically Black college and university, and a land-grant university located in Tuskegee, Alabama. Located in the middle of the Alabama Black Belt region, an area characterized historically by the rich prairie soils that made this area perfect for farming, it is now characterized by its relatively high populations of African Americans. Despite these challenges, the cultural and political history of the region is rich, as the region is the cradle of the civil rights movement, and many of its leaders were born here. As a land-grant university, Tuskegee University's mission includes the three pillars of teaching, research, and extension. This presentation represents displays of Tuskegee's contribution to the land-grant mission. We, now more than ever, want to serve our community, especially our brothers and sisters of color, as they are significantly more vulnerable as a result of health disparities, lower incomes, inadequate access to healthcare, and now inadequate access to COVID-19 testing. As a collective, in response to a call to action from Dr. Dolores Alexander, Director of IBS and Community Engagement Subcommittee of the Tuskegee University Community Health Task Force, we have put together answers and updates to common questions that can be shared near and wide. So to meet this objective of reaching more of our community, this seminar will be made available on all social media platforms and the Tuskegee University coronavirus webpage. At this time, I would like to introduce my colleague, Dr. Muhammad Omar, IBS Fellow and Cairo, Egypt native, who will present today's brief seminar. Dr. Omar has research experience with RNA viruses that behave similarly to SARS-CoV-2, the virus that causes the disease COVID-19. He has a Doctor of Veterinary Medicine degree and a Master of Science degree from the University of Sadat City and Cairo University, respectively. This presentation will then be followed by a question and answer session with experts from Tuskegee University, moderated by Mr. Lacard Webb, Master of Public Health, IBS Fellow, and native of Trinidad and Tobago.
Thanks, Lauren. Thank you all for attending this presentation. Today, we are going to talk about the unprecedented COVID-19 outbreak. The COVID-19 outbreak has been proven to be a result of a viral infection. So, what is a virus? A virus could be described as an obligatory intracellular parasite, which means that the virus must infect a living cell to reproduce and replicate itself. Here we have a schematic diagram showing the structure of the SARS coronavirus 2, which is the causative agent of the current outbreak. Inside the virus, we can see the genetic material, which carries the information required for making more copies of the virus. Surrounding this genetic material is the protein shell, which is represented here by the blue layer. This protein shell protects the genetic information as the virus travels between hosts or cells. Then we have the most outer layer represented here by the red color, which is called the envelope. This envelope composed mostly of fat, and this allows the virus to come in contact to the cells to infect them. Projecting from the envelope are proteins called spikes. Spikes we can see here, this one or other like tuft on the outer surface of the virus. The virus uses these spikes to insert its genetic information or the genetic material into the cells. So how does a virus like the coronavirus infect the host? Once the virus gains an access to mouth, nose, or eye, then to lung or trachea, the virus come in contact to the cells in this region, and the virus inserts its spikes into the receptor molecule present outside the cell, like lock and K or K and lock. This action allows the genetic material to be released inside the cell. where it comes, where it takes over the cell machinery to build the components of new viruses. By this way, the virus is copied, and the newly formed viruses are released from the cell to infect other cells. So when and where did the outbreak start? In December 2019, in Wuhan city in Hubei province in China, several cases of undiagnosed pneumonia have been reported to the local authorities in the cities. Uh, Pneumonia means inflammation of the lung, which is accompanied by several signs like cough or fever and chest pain and so on. The nature of science made the investigators or the authority in the city suspect the causative agent to be a virus. The usual suspects were influenza virus, MERS virus, and the SARS virus. MERS and the SARS are both types of coronaviruses, and China had a history with some of these viral infections. We will come in detail to them within a minute. Then the WHO started its investigation, and they found that all patients with the disease had a history of visiting the wet market in the city where live animals and birds were sold. At this time, it was believed that the causative agent is a virus with an animal origin. Later on, scientists and researchers in January 2020 could isolate the virus and identified it as SARS-CoV-2. According to the scientific analysis of the available information or available data, possibly the virus originated in bats. Then it jumped to humans through an intermediate host, which is possibly is the pangolin, as you can see here in the picture. Intermediate host could be like a mixed vessel where it get infected by two different viruses at the same time. And in case of SARS coronavirus 2, possibly what happened was the pangolin get infected by two different coronaviruses, which are the bat coronavirus and the pangolin coronavirus. And inside the pangolin, some sort or some kind of mixing or combination between the two viruses occurred, resulted in emerging or formation of the new virus. The structure of the new virus enabled it to infect human. Actually, COVID-19 pandemic proves to be a fertile breeding ground for conspiracy theory and other misleading information. And the problem with such theories in such critical times is that they could be a distraction for researchers and decision makers. Also, they could antagonize the exerted effort to maintain or to limit the virus's spread. In addition, it can feed stereotypes or racism or xenophobia. Xenophobia means that you are worried or fear from strangers or people who are from outside your country. So here we can mention some of this conspiracy theory or misleading information, because there are many of them. Like, the virus had been created in a lab in China. The virus is related to HIV, which is a causative agent of AIDS. The virus is just like flu, or 5G network can transmit the virus. Or also, there is also another misleading information claiming that USA arrested the professor at Harvard University who manufactured and sold the virus to China. Also, the misleading information about black people don't get affected as much as because they are protected by melanin and so on. And we all heard about the fake news about the superstar Idris Elba, who faking his COVID-19 diagnosis, and then he announced that he already get infected by the virus. Also, there was a claim that SARS coronavirus was invented and is a patent by a company, and some news articles about mentioned that COVID-19 is just a hoax and so on. All of these theories and the other has been refuted by science. So now let me distinguish between two common and widespread terms, which are SARS-CoV-2 and COVID-19. SARS-CoV-2 is the disease, is a virus, is what causes the disease, and it is abbreviation, and where SARS stands for severe acute respiratory syndrome, CO stands for corona, V stands for virus. 2 means that this virus is a second version of a previously known virus, which is SARS coronavirus 1. COVID-19 is a disease caused by the virus, where CO stands for corona, VI stands for virus, D stands for disease, 19 represents the year when the virus or the outbreak started, which is 2019. So many people may ask, have we seen this virus before? The answer, no, this is a completely new virus in human. However, we know many viruses related to it in the same family or group. This virus is included in a family called the Coronaviridae, which named for its characteristic shape under the microscope. Corona in Latin means crown, and these viruses have spikes on their outer surface, giving them the shape of crown. As I showed you, or I mentioned before in the structure of the virus, you can see here the protruding spikes of the outer surface of the virus, giving them the characteristic shape. So crown mean or corona mean crown. So despite it is a new virus, but there are many similarities between the current virus, which is SARS coronavirus 2, and the other members of the family. For example, the virus is identical to a bat coronavirus by 96% and identical to a pangolin coronavirus by 91%. Also, the virus has 80% of similarity between with the SARS coronavirus 1 and about 50% similarity with other coronaviruses which cause the common cold. Actually, coronavirus or the Coronaviridae family is include a large number of viruses. Some of this could infect only birds, others could infect human, others could infect either human or birds, and so on. So when we come to human coronaviruses, we have totally 7 types who could infect the human. Before 4 types were known before 2002, but with no interest because they infect human but causing mild disease. So they are considered as common cold causing viruses. In 2002, a new coronavirus had been emerged in China, which was SARS coronavirus 1, and resulted in an outbreak that affected about 37 countries and resulted in about 8,000 reported cases and about 800 deaths. The virus came from bat, originated in bat, and come to humans through an intermediate host, which was a civet. Civet is a wild type of cat present in China mostly. In 10 years forward or later, in 2012, MERS coronavirus also has been emerged in Saudi Arabia, resulted in an outbreak, affected many countries, especially in the Middle East, with about 2.5 thousand reported cases and about 800 deaths. The same scenario, the virus originated from a bat to humans through an intermediate host, which was in this case a camel. Now we have the SARS coronavirus 2, the cause of the current, or the cause agent of the current outbreak, affecting more than or spread in more than 200 countries and territories all over the world, with about 2 million reported cases and about 120,000 deaths. Till now, as I mentioned, possibly the virus came from animals, from a bat to humans through an intermediate host, which is the pangolin. So when we come to the disease, which is COVID-19, the disease has several forms or stages. Stage 1 of the disease, or we call it incubation period of the virus, starts directly after you get the infection and may last for 2 days up to 2 weeks. In this stage, no clinical signs or symptoms, and you can transmit the virus to other persons without showing any signs. So if you have a history of travel abroad or contact with an infected person, you have to isolate yourself for 2 to 4 weeks. Stage 2, or the mild form of the disease, includes symptoms or signs of mild pneumonia. As I mentioned before pneumonia is inflammation of the lung, and these signs include fever, cough, shortness of breath. You also may encounter other symptoms like diarrhea, nausea, vomition, or loss of taste and smell. This stage is not fatal, and recovery may take up to 2 weeks. If you have the signs, you have to isolate yourself and call your health provider. Stage 3, or the severe form of the disease, includes symptoms of severe respiratory distress, including hard breathing and increase of breath rate. This stage can be fatal, and you need to be hospitalized because you will need a ventilator to help you breathing. Then we have the critical case or the critical form of the COVID-19. Numbers show that 5% of reported COVID-19 patients underwent through this stage. Mainly, this stage is related to underlying health conditions like diabetes, asthma, or other lung disease, hypertension, or other heart disease, also kidney disease. Symptoms of this stage or this form include respiratory failure and septic shock. Septic shock simply means some toxins come into the blood and become circulate all over the body and may reach other organs, which may lead to multi-organ function or multi-organ failure. 50% of these patients die, and this represents about 2.5% of the all total number or number of COVID-19 cases. So, how can the virus cause the disease, or how can you develop signs of pneumonia? So first, let me start with the normal condition in a healthy person. We have here the lung have two loops, right and left one. And when you breathe normally, the air moves freely through the trachea, then to bronchi, then to bronchioles, and finally into a very tiny sac called alveoli. Here is a zoom of a section taken for alveoli. This alveoli is a place where oxygen or the gas exchange occur inside your lung. And for this alveoli is surrounded or are surrounded by a very tiny blood vessels called capillary, where carbon dioxide and oxygen exchanged between in and outside the body. So, as I mentioned, in normal cases, these airways are lined by mucus from the inside. So this mucus can catch or trap germs or any other microbes when come to this area. And then you can easily expel these germs outside your body through coughing or sneezing and so on. Also, there are some types of immune cells which can attack viruses or any other microbes, and your body then get rid of these microbes easily without showing any signs. However, in case of SARS coronavirus 2 infection, your immune system get overwhelmed, and the immune cells try to attack the virus, the multiplying virus inside your alveoli or inside your cells, either by engulfing this virus or producing some chemical substances which could affect the virus. But this attacks results also in inflammation of your alveoli and the bronchioles. So your alveoli get inflamed, a fluid come inside the alveoli, and your alveoli now become filled with fluid, and so no space for exchange gases, and your body can't get the oxygen it needs. Like someone when he is drowning, he get much amount of water into the lung, so no space for gas exchange. This is exactly what happened. This inflammation or pneumonia caused difficulty breathing, chest pain, fever, chills, coughing, muscle pain, fatigue, and so on. It can also develop into serious complications like respiratory failure, where your breathing becomes very difficult that you need a ventilator to help you breathing. So we are now facing a new disease with some characteristics. So some of the characteristics of the disease, it is a contagious disease. Contagious disease means it is very easy to spread between people. You can see that one infected person can transfer the infection to other two people or three people. So it is a contagious disease. So it is very easy to spread between people. Also, it is a sustained infection. Sustained infection means that each newly infected person can start other series of infections. So the virus goes spread without stop. And in a recent study showed that one person could be the point or the origin of other 1 million persons infected with the disease within only 2 months. So it is a sustained infection. The death rate of from the disease, it is average percent. Globally is range from 2 to 6%. This is the average percent globally, but this rate or this percent may vary according to other factors like age, regions, or health conditions. So when it comes to distribution or of the cases around the world, this is the update to yesterday evening, because you know the numbers of cases, and this is updated by the end of the day. So this is updated numbers to yesterday evening. Globally, over 200 countries and territories are affected by the virus, with total number of confirmed cases about 2 million and about 120,000 deaths. In USA, we have about 0.6 million reported cases with about 24,000 deaths. Also, we can see the New York and Louisiana, which have a very large number of confirmed cases, and this is in Alabama. The number of reported cases till now is about 4,000 reported cases with about 100 deaths. In Macon County, we have 17 reported cases or confirmed cases with the disease and only one death. But in Macon County, you can see the number of tests which had been carried out, it is very low. So these numbers aren't reflecting the actual or the true picture of the situation in Macon County, because we need more and more testing. In USA, it is the first time in the history that all states become under threat of one infectious agent or under threat of one disease at the same time. So it is a big disaster. So here we have a map showing the distribution of reported cases of the COVID-19 patients. Each color represent a vary or a range of the number of reported cases. The darker the color, the more reported cases. When come to the African American community, we know all that African Americans represent about 14% of the USA population. 1/3 or 33% of the hospitalized COVID-19 patients were African Americans. Also, African American deaths are reached about 70% of the total deaths in some states like Louisiana. In Alabama state, African Americans represent about 28% of the total population, and the African American COVID-19 patients are 37% of total reported cases and represent 53% of the total deaths. This is actually or mostly because the large number of other medical issues spread in the African American community. So these underlying medical conditions might make it more likely that African Americans are admitted to the intensive care units or die from the disease. So who can or who is susceptible to get the infection? Actually, being live human is making you susceptible to take the infection. So all ages, all races are susceptible to get the infection. However, severity of the disease increase with age and underlying health condition, especially if these elder people receive a poor care. For example, there is now a running investigation in Massachusetts about a veteran home. They found about 28 people or persons in this home who were died after testing positive of the COVID-19. So there is a relation, of course, between poor care received and the severity of the disease and the number of deaths. However, severe cases between healthy and younger people have been reported also. When it comes to children, children also are susceptible or can get the infection, but the disease in children is typically mild disease. So they can get the infection with very mild signs or with no signs, and they get recovered very fast. But it's still an important point is that these children become if they get the infection without any signs, they become a source of infection to surrounding households or persons. So it is a very important point to put in our considerations. So now, how can I get the infection? The source of infection is the infected droplets which came out from your mouth or nose during normal talk, normal breath, or coughing, sneezing. And here we can see a diagram showing how far droplets travels. So in normal breathing or exhalation, the droplets can travel up to 4.5 feet. And in case of sneezing, these droplets can travel up to 24 feet. The mode of transmission or method of transmission is the direct contact or close contact with an infected person or an infected surface. Route of infection, which means how can the virus get inside my body. So the route of infection of SARS coronavirus 2 are mouth, nose, and eyes. So when we come to testing status on the availability, till now, the only approved method for testing is the molecular one, which is PCR test. They take a nasal swab and you can get the result within 3 to 5 days. However, there are many trials are running now, led by NIH, to improve a serological test who could detect or screen for antibodies inside the blood. However, this test will not be used to detect active cases, but it can be helpful in giving us an overall image about the developed immunity of the community, so we know where we are now regarding to the disease. Also, some companies start to improve, like Abbott started to improve a rapid test, very rapid test. It's called the SNAP test, like pregnancy diagnosis test, which you can you can get the result within 15 minutes. And also, it is a serological test depend on antibody antigen reaction. So the treatment and the vaccines availability of COVID-19, till now, no specific drug have been approved from FDA for COVID-19. No specific drug. We don't have any specific drug which is approved specifically to be used against COVID-19. All what we have or what we do for mild or moderate cases, which show the symptoms, they use a drug to relieve symptoms, at home for 2 weeks, and continue quarantine 3 days after symptoms have gone away without any treatment. There are also existing protocols which vary from state to state or from country to country. In these protocols, they use antiviral drugs and some drugs to relieve symptoms, maybe non-steroidal anti-inflammatory like ibuprofen. And when you say or when you hear approved drugs, some people say we heard about approved drugs. No, the approved one is approved clinical trials. This approved clinical trials mean that they approve using of some existing drugs which are used for treatment other disease, and they still investigate the efficacy of these drugs or side effects against the COVID-19. Some of these approved clinical trials are hydroxychloroquine, which is a drug used for malaria and rheumatoid patients. But however, till now studies or the clinical trial shows some risk of side effects of using hydroxychloroquine in patients, like risk of heart and vision problems, liver and renal failure. So it isn't approved till now. We have to be very cautious with dealing with this type of drugs. Also, there are some kinds of antiviral drugs like favipiravir, which is a Japanese drug used for treatment of flu. Also, remdesivir, which is anti-Ebola. Ebola is a very dangerous virus, so remdesivir also approved for clinical trial against COVID-19. Deferoxamine, which is a treatment for iron overdose. Also, there is approved clinical trial for using a convalescent plasma from recovered persons who have a protecting antibody. And they can use this in like in severe cases or emergency cases. When it comes to the vaccine, also we don't have any approved vaccine till now, because this is a new virus, and the production of a new vaccine is very complicated process, and it takes many times. It may reach to up to 2 years. However, this production or the process of production goes through several phases. What we have now is some companies started the phase 1 of this clinical trials for some vaccine. Phase 1 meaning that they bring a very new number of healthy people and try the vaccine which they intend to produce on them and investigate the side effect and the safety margin and so on. So this is just we have till now. So what can we do? We have heard many times about we have to flatten the curve or blank the curve and so on. So what does it actually mean? So when we are talking about the flatten the curve or the curve, we mean the number of people who get sick in a certain period of time. So we have here the x-axis represents the number of cases, and the y-axis represents the time since the first case. And we have here an imaginary line representing the healthcare system capacity. So when a large number of people get sick in a short period, the curve rises faster. And if this happened, it surpassed or overcomes the healthcare system capacity. So our system become overwhelmed. So what we need is to flatten the curve. Flatten the curve meaning reduce the number or slow down the number of people who get sick in certain time. As we can see here, instead of this one, we want to go through this one. This is what I mean. So if we could extend the time, we can improve or increase the capacity of our health system. So what actually the steps can we take to flatten the curve? Number one, and the most important one, is to stay at home or self-quarantine at home. You can imagine the virus is feeding on our bodies. So as I mentioned before, one infected person can transfer the infection to 2 or 3 people, and every people can start a new series of infections. So you can imagine here, if we cut this way, how many people we save them from getting infected by the virus. So it is a very important and a very powerful weapon we have now. Stay at home or self-quarantine at home. If you have to go out, you have to keep social distancing. Social distancing simply means to remain at least 6 feet away from others. And recently, CDC recommended wearing masks to cover your nose and your mouth, because you may have the infection without showing any signs, and you can transmit the infection to other people without showing any signs. So wearing a mask is an important step. Also, You have to keep washing your hand regularly with water and soap, and still keep rubbing your hand with at least 20 seconds. As I mentioned before, in the structure of the virus, the outer layer of the virus is composed of mostly of fat. So the soup can dissolve this fat and destruct the virus or make it weak and couldn't infect the cell. So keep washing your hand with water and soap for at least 20 seconds. Also try to not don't touch your mouth, nose, eyes, and so on. If you sneeze, please, or cough, use a tissue and throw it in the trash or use your elbow. Also, you have to keep surface cleaning all the time using disinfectant or the detergent, because the virus can stay stable on surfaces for certain time of period. This period or this time varies according to the type of the surface. So we can here see the virus can stand or can stay stable on cardboard for 24 hours, and can stay stable on plastic or stainless steel up to 72 hours. So when it comes to the detergent and disinfectant which we use, the virus is very sensitive, as I mentioned, to detergent, alcohol, and heat. Some of the disinfectants you can find a very long list on EPA, which approved many types of disinfectant and detergent for using against COVID-19 or SARS coronavirus 2. Some of them are bleach, alcohol, vinegar, and soap, and sanitizer, hand sanitizer. Whatever the kind of detergent or anti-disinfectant you use, but please don't mix these cleaning products with each other, because mixing of them may results in production of a gas or vapor, which is very, very harmful. So please don't mix bleach and vinegar. Don't mix bleach with ammonia. Don't mix bleach with rubbing alcohol. Don't mix hydrogen peroxide and vinegar. So a very important point when it comes to the SARS coronavirus disease or SARS coronavirus 2 and the animals, we now know this virus, so it is a zoonotic disease. And we have several cases of cats and dogs, and recently a tiger in New York have been reported. Some of these animals showed signs. So as I mentioned, we have a new virus, so we need more studies and investigation to confirm or to make sure from the nature of this disease, especially the transmission. Till now, transmission from pets to human isn't confirmed. Some people may say, I have my pet or I have a domestic bird or even the cattle, and I vaccinate them regularly with a coronavirus. As I mentioned before, animals and birds have a different kind or a different type of coronavirus that infects them. So vaccination of these animals with other specific coronavirus vaccine doesn't protect against the SARS coronavirus 2, which is currently circulating and causing the infection. And here some precautions as a veterinarian I can provide to you. Just keep your pets away from your face. Regularly dip their feet in a safe disinfectant, especially after an outdoor walk. Wash your hands before and after contact with your pets. And please, if you have any symptoms, isolate yourself away from your pet. Finally, I would acknowledge Integrative Bioscience PhD program, Department of Graduate Public Health, Tuskegee University faculty, staff, and students, College of Agriculture, Environment, and Nutritional Sciences, College of Arts and Science, College of Veterinary Medicine. Also, our acknowledgement extended to Tuskegee University Cooperative Extension Program, Tuskegee University Community Health Task Force, and the Community Engagement Subcommittee, and George Washington Carver Agriculture Experimental Station. Thank you.
I'm Lucard Webb, as Ms. Mayo stated earlier, and I will now provide some key take-home public health pointers based on the information provided by my colleagues, especially during this time of adversity. It is clear that COVID-19 pandemic, it's not a conspiracy, but it is real, and it's affecting individuals across the globe. It does not discriminate by age, race, or ethnicity. Because the virus that causes COVID-19 is thought to spread mainly from person to person, it is important that we all play an important role to stop the spread of this virus in our communities. Community spread means people have been infected with the virus in an area, including some who are not sure how or even where they became infected. And they spread the virus to others in their communities. Sometimes it can be in their own homes, sometimes it could be in their own churches. COVID-19 cases that have been reported have been in the form of mild to severe respiratory illness. This means that infected individuals can be either asymptomatic, meaning that they don't show any signs of illness, or symptomatic, meaning that they show the signs of illness. If you develop mild symptoms and have been in close contact with a person known to have COVID-19, your first action should be to quarantine yourself from others. Do not visit a health facility unless your symptoms become very severe, such as having trouble breathing or persistent pain or pressure in the chest. You can also call your primary healthcare provider or the COVID-19 hotline to seek medical advice. Next slide. So other public health measures include, creating a household plan of action. So we need to designate a point person from the household to go out for essential supplies if necessary. And upon their return, take measures such as washing their hands and sanitizing. Please note that wearing facial masks in public is an additional public health measure to reduce the spread of COVID-19, but it is not a replacement for social distancing. Plan ways to help protect your health and the health of those you care about in the event of an outbreak of COVID-19 in your community. So you need to know resources available to you, such as websites or contact numbers. You need to plan ways to care for those who might be at greater risk for serious complications, particularly older adults and those with severe chronic medical conditions like heart, lung, or kidney disease. Create a list of local organizations that you and your household can contact in the event that you need more access to information, healthcare services, support, and other resources. Create an emergency contact list of family, friends, neighbors, healthcare providers, and local public health department and other community resources. Plan ways to take care of your animals and pets should you need to quarantine. Next slide. So, as a special note to our communities of color, the data that has been presented is showing that we are more likely to die from the disease than white Americans. Given the fact that we face increased economic and social health inequities, it is important that we pay close attention to the prevention guidelines provided by the Department of Public Health and the CDC. We also need to become empowered to inform our families and friends and to reduce as far as possible the spread of the virus leading to COVID-19. Let's flatten that curve. We thank the Tuskegee University Community Health Task Force under the leadership of Acting President Ruby Perry for the opportunity to present this seminar in this important forum as we all play a crucial role to keep our communities healthy during this time.